So thank you guys. Thank you, Jill, for inviting us. So we have 15 minutes to talk all the issues with prior authorization. So I'm going to start off, and then I just want to sort of bring up, it's amazing to me, when I first started working in this, we had Sandostatin, we had octreotide 3 times a day was the only option. And if you look at all of the pharmaceutical company representatives that are here, just the amount of medication and choices and options that are out there is just amazing to me. So, but with that comes, challenges with paying for them, and the authorization, and insurance companies haven't helped in that over the course of the many decades that it's taken for these medications to come to fruition. So, in thinking about medical therapy considerations, we want to take into, as a physician who's comfortable with it, what the mechanism of action is, what is sort of best for the patient. So we certainly consider that. Obviously, the patient preference, how does it work in with your lifestyles? How does it work in with cost issues, that kind of thing. So we definitely consider that in terms of whether it's a daily sub-Q, whether it's a monthly injection, or potentially some oral medications. And again, how does that fit into your personal schedule and lifestyle? So if you're traveling a lot, maybe the sub-Q isn't the best choice, kind of thing. Obviously, insurance coverage is a big part of this. And then, patient resources. What's the familiarity with the prescription process? Maybe some practices are a little bit more familiar with some of these prescription and prior authorization processes. Do we have a staff that's designated to manage the insurance? Not our practice is very unique, and I think we have a prior authorization specialist that just does this all day long, 7 days a week. So, but that's unusual, and I don't think a lot of practices have that. And I think a lot of the hiccups come with not being familiar with the prior authorization piece of this. And then the expertise in administering the medication. So our practice is comfortable with doing the monthly injections. Are they more apt to do a sub-Q injection, that kind of thing? So we take all of that into consideration when we look at medical therapy. The insurance piece, obviously, as you guys know, adds complexity to doing these approvals. So they're medications that are great, they work fantastically, but this whole prior auth adds a complexity, both for the patients and for the practices. It may result in approval delays if you're not familiar with it, or if you're having issues with insurance companies. And it could be a challenge, as I mentioned before, if practices don't have the staff, or the staff is not familiar with how to get these medications approved. There's high out-of-pocket costs. So the copays and deductibles are very high, as you guys know. I'm sure we'll hear your questions later on. If there's gaps in coverage and changes with insurance, that causes some delays, obviously. And then, some medications come with, or insurance companies are requiring, you got to try it or fail it before you can actually get to the medication that you actually want. So that's also a challenge. So for our practice, we talked to our prior authorization specialist, and she uses this program called Cover My Meds. I'm not sure if anybody's familiar with that, but she uses it for all of the medications. So whether it's related to Cushing's or related to acromegaly. And it's basically a medication access company that helps healthcare providers, payers, and patients navigate obtaining and paying for these medications. The process is we would submit the patient's insurance information, any clinical notes, lab results, imaging results, similar to the prior authorization that each company usually has. And then they're able to see the plan requirement for a given medication. So this is not an insurance plan, and nor is it medication specific, although some insurance plans won't allow us to use that and require their own process. For the insurance verification, if we don't use Cover My Meds, there are other programs, and this is the list of some of the other programs that we've used. As I mentioned, MGH mainly uses this for copay insurance assistance inquiry. But these are also helpful for practices that don't have prior authorization specialists. If you're going to get started on a patient with, Ipsen or the KAC Total Care. These are types of programs that really work well with the company, if you're looking into that. All right.
And so, just like Karen said, these medications can be really high cost. And so we use those programs that Karen mentioned really to try to get patients medications through their pharmacy benefits. But sometimes, and especially in situations where patients have Medicare, the pharmacy benefits really are not going to cover the majority of this expensive cost. Medicare covers 80%, and then 20% of thousands of dollars is really going to be a huge hit for patients. So we do a lot of buy-and-bill, what we call buy-and-bill. And buy-and-bill is really a situation where the patients come to an office, and it can be a physician's office, it can be an infusion center, it can be a lot of different kind of scenarios. And that place purchases the medication and then bills it to the insurance through the patient's medical care. So not their pharmaceutical care, their medical plan. And that actually erases the copay. They may have a copay for the visit, but it erases the copay for the medication, and that can be really helpful for patients to afford these medications. And the caveat to that is, though, you have to find a place that is local to you that will be able to purchase this medication. And a small doctor's office in a small rural area may not have the funds to say, I'm going to put out thousands of dollars for this medication, just to hopefully get paid by Medicare months, weeks, years later. And they may not be able to have that in their budget. And that's a complicated piece to this. That's where infusion centers, hospital-based infusion centers really come in handy for us. We found that they've been really helpful for getting patients that can't come to MGH, which is a big hospital that can really take these kind of hits and carry these kind of expensive medications. So that's been something that's been really helpful. And again, finding those for people who are in rural areas, though, can be a real challenge for us. And some of the other things that we use for offsetting the cost is some of the pharmaceutical companies do offer copay insurance. We've seen that it's actually becoming less and less. Some of the companies are no longer offering that, and that's been very frustrating for patients. We've had to change medications because of that. Patients have been on certain medications for decades, and we've had to change them, and that can be really problematic for patients and difficult for their own situations. And then the other problem with these pharmaceutical copay insurances is that copay companies is that they don't cover Medicare patients. And we find that that's a big portion of our population. So that can be really tricky. State and federal assistance programs sometimes help. We're seeing cuts in that as well now, so that can be challenging. And then there's some assistance programs that come from the pharmaceutical companies for people who have financial challenges that are really helpful. And sometimes MGH, we've seen, has had some special programs that they have access to. I don't know if that's something that's specific to just large academic organizations, or if that's something that happens in other places. We don't have a good handle on that, but that we do see that some of our patients are able to get some special programs through the Mass General Pharmacy, specialty pharmacy. And then Karen comes through a lot for our patients who qualify for all of the clinical trials for all of these amazing medications. Those clinical trials often come through big academic centers like ours, and they really offer patients a chance to try a drug that's coming out that's new and has some really incredible potential. And then they can be in that trial, they can get that medication for free, and then in certain situations, they get to stay on that medication, and after the study is over, and continue with that medication also at no cost. And that can be really incredible and really helpful for patients, especially if they found a medication that works really well for them and their lifestyle. So, so just sort of to summarize, the stuff that's really worked for our practice is educating patients on how important these medications are for their health, for their longevity, for how they're going to feel, and for their acromegaly care, and then working with them very, very specifically on how we can best either go through their pharmaceutical program or go through their medical program their medical insurance to help them pay for these medications that are really quite expensive. We have been really, really lucky that we have this embedded. She sits right next to me. Every day I listen to her on the phone fighting for you guys, you know, being on hold for hours and hours a day, working really hard to make sure that you guys get the meds that you need. But that is not something that every place can have. You know, she's in our practice, she talks to the doctors, she has access to the, you know, to the doctors and getting prior approval letters and letters of medical necessity. Not everybody has that. I know there are offices where the nurse does the prior authorization or the medical assistant does it. And that can be really hard because they're trying to do all the rest of their job as well. So we're really lucky to have that. And it's ideal if you can. And then using Cover My Meds we find is really good. Our prior authorization specialist really relies on Cover My Meds. It's quick, it's easy. She can keep track of all of the prior auths she does. They're all in the system. She can get at, you know, navigate to them really easily. It's been a really incredible tool for us. And then Medicare patients, again, if they're unable to come to our office, we actually have a lot of patients too that kind of travel, you know, seasonally to Florida or places, you know, other than Massachusetts, and we find these infusion centers have been really, really helpful. The caveat to that is that infusion centers mostly give medications that they also give for cancer, and that's mostly just the octreotide, the sandostatins and the somatulines. So that can be a little bit tricky. It's not so much for the shorter acting medications. And then, you know, our docs, we have one of our docs is right here. It's just having doctors that are supportive, that are helpful, that will write letters, that will fight for their patients. That's really important and really been key to our practice.